free to introduce yourself in the chat or come off mute if you have a comment or question. We encourage everyone to ask questions throughout the presentation using the chat or during their Q&A. We love community feedback, so please complete the virtual suggestion box after the session, and I will drop that link in the chat for everyone to utilize. And so with that being said, tonight we are talking about something that has the potential to shape the future of sickle cell care in Texas. And as a proud Texan, that's something I'm excited about, and that is the Texas Sickle Cell Registry. We are fortunate to have representatives from the Texas Department of State Health Services joining us to explain the registry, discuss the opt-in process, and to hear directly from you. So I have their introductions. Victoria couldn't make it tonight. She's not feeling well. So we hope Victoria feels well. We send her well wishes.
Thank you.
Thank you.
Yes, in the sickle cell community, we definitely understand sickness happens. So the other presenters who information I do have is Prashant Sharma. He is a business analyst in the Environmental Epidemiology and Disease Registry section at the Texas Department of State Services. He serves as the lead for researching and developing IT requirements to inform the implementation of the Texas Sickle Cell Registry. Prashant received his Master's of Business Administration from Seattle University and Bachelor's of Science from Washington State University. So thank you so much for joining us, and you can begin.
Okay, we also have Heidi on the call. Heidi, did you want to give a quick introduction as well?
Yeah. Sure, I can just start talking too. I want to do the presentation if that's okay. Yeah, so hello everyone, my name is Heidi Boyes. I'm the director of the Environmental Epidemiology and Disease Registry section with the Texas Department of State Health Services, or DSHS. And DSHS is basically the state's health department. And I'm here with Prashant, filling in for Victoria. And we're here to talk about the Sickle Cell Disease Registry and focusing on the proposed registry's opt-in process and to answer questions. Next slide.
Perfect.
Okay. And then during the last legislative session in 2025, House Bill 107 relating to the establishment of the Sickle Cell Disease Registry was passed. And the bill was codified into law and can be found under Chapter 52B of the Texas Health and Safety Code. And the Sickle Cell Registry, as outlined in Chapter 52B, directs the State Health Department to establish and maintain a sickle cell disease registry. And the law also requires that an individual, before any information relating to that individual any information of that information is included in the sickle cell disease, the person has to consent. And this is also referred to as an opt-in registry.
Awesome.
Okay, and so, next slide. And so to properly address the requirements of this sickle cell disease registry, and before the registry is implemented, we are conducting a registry assessment to inform the development of the registry, and we obtained an expert group of IT consultants to help us with this effort, and Prashant is one of our IT consultants. And the objectives of the registry include meeting with other states that have sickle cell disease registries to learn about their setup, the best practices, and lessons learned. And as you made, last time we showed you that we found 5 other states with sickle cell disease registries that have implemented a registry. And of those 5 states, only one of the registries is an opt-in registry. And the other objective is to engage stakeholders who will use this data to inform sickle cell policy, healthcare practice and treatments in Texas. And what we would like, or what we're hoping to get from the stakeholders, are feedback and input so we can create a better registry. With this information, we'll be better equipped. Well, not yet. We'll be better equipped to propose appropriate IT solutions and costs to our agency leadership and during the next legislative session. Okay, next slide. Okay, and so the registry, as outlined in the law, is unique from most other disease registries operated and maintained at DSHS in that it requires consent of an individual for their health records to be included in the registry. And this is called opt-in. So in contrast, other disease registries at DSHS are called opt-out, which assumes consent and gives the health department authority to collect health records. And a person must formally request for records not to be included or opt out. And so we have come up with a proposal to take an active approach in identifying individuals with sickle cell disease and reaching out to them for consent to be included in the registry. And I'll turn it over to Prashant to describe this approach in more detail. And we welcome your questions and feedback. Thanks.
Thank you, Heidi. That was great. Okay, so let's get to the registry proposed opt-in process because our registry is special here. So before we go here, I want to just make something clear is that we don't have a registry yet. This is just the scope of the registry that we're going to be building. I know you're wondering if we already have this registry, but that's where we're at with this. And the scope of this is, as you can see, it's case finding, consent, and then moving that data into the registry. And I'm going to go, step by step here to review all of this. So the first thing we're going to do is identify sickle cell disease cases. So how we're going to do that is we're going to look at, places like newborn screening, EHRs, electronic health records, and we're going to go through and find maybe, patients that, through newborn screening or through EHR, we attribute to having sickle cell disease. And what we'll do is we'll find their information, put it into a case finding database, and basically reach out to them and say, hey, we have a sickle cell, when we have a sickle cell disease registry, we would like for you to know that we have one and if you would like to opt in. So that's one way we're being proactive, going out of our way to get that information to help get more patients into the registry. And then also to get their consent, patients will have the ability to provide consent via several different methods. One will be online. They can go online, fill out a form. Second will be they can mail a paper form. And third, we're looking at, we can do fax as well, right? They could be at a hospital. The hospital can fax the form for them if they don't feel like doing it online, but we'll give them a bunch of options to be able to do that. Are there any questions about this before we move on to the next section of how we're going to be proactive and identify SCD cases?
I actually have a question.
Sure.
So just listening to you now, would it be possible for, I guess it would be Texas Health and Human Services, this team to like maybe table at sickle cell events and spread the word that way, like direct in front of patients, or does it have to go through these channels that are identified on this slide?
So maybe Heidi can speak to that, but you're saying if we can go in front of patients and give them more information about the sickle cell disease registry?
Yes.
Yes. So Heidi, can you help with that question? I don't know if you've planned on.
I think that's a great idea. And in order to spread the word more, I think we'll have to do a lot of outreach and education. So going to community events and tabling is a great idea. Yeah. And once the registry is implemented, we'll do that more full force. Yeah.
Well, I'll definitely be in touch then because I have some stuff coming up and I would love to. I'm excited hearing about the registry, and I'm so excited that Texas is closer to having one.
It's closer, and I can refer to Josiah. I'm sorry if I'm messing up your name, to tell you a little bit more about the timing and how that works. Yeah. So
Well, and again, I don't know if I can necessarily speak to that, but again, and again, Heidi, you correct me if I'm wrong, but I believe my understanding is right now, in order to sorry, back up. What was the question again?
I was just wanting to see if you can provide some information about the timing of the registry, because it's, right now we're coming up with the design and the cost estimate.
Yeah.
We'll have to go take that information to the legislature
Right. So,
to get like that sort of thing.
Yeah, and I don't know all the ins and outs of that necessarily, other than what I will say is, yeah, it's in order for right now, it's not funded to the full extent that it would take to do the full-on registry, and so until the legislature appropriates those funds, I think this is kind of the stopgap to kind of study what the registry would look like and how to figure that out. But the timing is complicated on these things. I mean, I don't know what the hypothetical full registry would look like, but again, it would be sometime after the legislative session in 2027. And I don't know what it would look like moving forward, and it'll take time to stand it up. But this is kind of, in the meantime, we're kind of looking at what that would look like. But yeah, like you said, it's a step closer, but it will still take some time for these things to kind of get funded, and it also depends on the local legislature and what they want to do. So, it's all kind of a slow process, I would say.
Any other questions regarding this before I move on to the next step? Okay. So let's go on to the next one, which is determining consent decision. So we're going to have a case finding database that's basically going to store consents and just patient name and information, just so we can contact them. What we're going to do then is look at the database, and then we're going to look at, has the patient provided a decision on the consent, right? So if they've already provided a decision, then we look what kind of decision they provided, whether it was opt-in or opt-out, and let's start with the opt-out process. So if they provided a decision and said, you know what, I'm just going to say I don't want to be part of the registry, we then see if they had originally ever opted in before. If they had opted in before and now they're deciding that they want to opt out, we delete their data from the registry when they opt out. So that's something we want to be very clear, and just let everybody know that if you do opt out, we will delete your data from the registry. And again, if they opted out and they never had previously opted in, then there's no further action required because we haven't put their data in the registry. Okay, so that's the one decision of if they've already provided a decision for opt-out. Now, if we look at the patient and the patient has never provided a decision, never given us an opt-in or an opt-out, we will do an outreach process, which I'll go over next. But that's for when we've never had any consent in any form from the patient. But in case we have had a decision from a patient and it's an opt-in, then we will take their data and move it into the registry. So once we have an opt-in data, we'll take all their medical, their PHI, PII, and move it all into the registry once we've captured their decision. Any questions as to how we determine their consent and what we're doing once they opt in or opt out? Okay, going once, twice. Okay, I think we're good. Let's go on to the last one, which is the outreach for consent. So if we look at the other one, when we see has a patient provided a consent decision, and if it's no, they've never given us an opt-in or opt-out, we will do an outreach. And that outreach will start with an initial letter that'll go to the patient address that we have. And we'll reach out and say, hey, we have a registry. We'll provide some other bits of information, give them how they can go about doing that. And then we'll see if, within 30 days, if they've provided us a consent. If they haven't, we will do it again, whether it's a mail, email, etc. We have different ways that we're enabling the way to contact them based on the information we have. So we'll have a second contact after 30 days. And then if we get nothing after 15 days, we'll do a third contact. And then we'll wait again for 15 days. Now, if we don't get a response after 60 days, we will basically set that patient away and say we'll reach out to them annually. So if we don't get a response, we'll reach out annually. Now, if we do get a response, we will take that response and document it in the case finding database that we have. And based on their response, we'll figure out what to do. If they opt in, then we'll take their data and move it into the registry. And obviously, if they opt out, because this is their first time providing us a decision, we will not do anything with their data and not move it to the registry. One thing I'd also like to be clear is patients can always opt out and then opt in, and vice versa, right? So they can change their mind at a later time, and based on what I mentioned earlier, is will delete their data. So any question for outreach, anything that you see that we could maybe improve in terms of outreach, any suggestions, anything, we're here to listen and take feedback.
Well, as y'all can see, I don't mind talking, so I can hop in. Well, the first thing I stated, attending sickle cell community events, like tabling at events, I think would be a great way. And platforms like this, Join and Escalate, is great. And I don't know, I kind of went blank there, but I love the idea of that if you opt out, that your data is deleted. And I think we should also just lead with how important it is. I think that's a part of the education that's really important for people like us with sickle cell to understand the importance of a registry and why it's important for you to want to be a part of it so that our state has this data. Because I think a lot of like the typical everyday sickle cell patient is unaware as to why that's important. So
that's a great point. And we will actually have that on the website where, we have a little bit of information of why, etc. So it's good that we have you saying that as well, because we definitely want to put something out there. And then we'll look at the initial letter as well and what we want to send with that as well. So that's a good feedback. Thank you.
Yeah, I'm just, like I said at the beginning, I'm excited about this. I helped with pushing the House bill, so I'm always excited about this kind of stuff.
Awesome.
Let me see. Let me check the chat. My laptop is super slow.
So while you do that, can I pose a question? So we are thinking of creating a web link where people can access it online and fill out all the information. Do you think a QR code or something on the phone app, like what do you think would be the best way to get the easiest way for most people to join?
I think a QR code is always a good way to join. The flyer for this event had a QR code for registration. I use QR codes for almost everything I plan.
Perfect.
And if y'all have like a social media or a YouTube or something so that people can access it where they are already, like if they're scrolling and it comes across as an ad or something. And just, partnering with community-based organizations, attending their events.
Yeah, that's a great idea.
Yeah. But next week, a lot of us will be in Los Angeles for the Warrior Con 26. That's hosted by another organization called the Sickle Cell Community Consortium. I'm a partner. The As One Foundation is a partnered organization as well. And that event is hosted annually, and about 600 sickle cell warriors and caregivers are at that event. So, like, just attending events like that, doing this presentation there, you have your audience and people learn directly from the source. A lot of times that gives people, you're more at ease when you're learning straight from the source. So
yeah, I agree with that. And then you can answer questions and people are more likely to ask. I'm more likely to ask a question when I'm just talking to someone one-on-one than as opposed to a big conference room in front of a lot of people.
Yeah, and that's where tabling would help out at. Or I'm here in Dallas. We have our hospital hosts a support group quarterly. So attending stuff like that, they're always looking for speakers for the support group. So just think of those different channels and avenues to reach the patients besides, through what y'all already have. the channels you're already using. And hi, Miss Etta. Etta is one of our golden warriors. That means she's over the age of 60. So, and she's part of the Sickle Cell Consortium too. But other than that, we don't have any other questions in the chat.
Okay.
Was that the end of the
That is
presentation?
the end. Yep, it was just
Yeah.
questions. I will stop sharing then if we're good to go.
Yeah. Yeah. And then for children under 18, we'll rely on the parents or the guardians for the consenting in. And we thought of when they receive their newborn screening results, having some information in the packet the family members get.
So you're saying, make sure. So you're saying when the family gets sent that their child has sickle cell or sickle cell traits, they would also get the information about the registry in that.
Right. We're thinking of doing that. What do you think?
I think that's a great idea.
Yeah.
I think that's a great idea. And I also think it'll give new parents a sense of, oh, they care about our illness if they want to make a registry for it. So I think that's a great idea. My mom said when I was diagnosed, she just got a letter, one single letter.
Oh my God.
And well, she got a phone call, I think, because I had the illness. But when you have just trait, you just get a letter. Yeah.
Yeah. And also just to clarify that the law as it is written now is just the disease. So it doesn't include the trait at all.
Yeah. Oh, for the registry?
Mm-hmm.
If Dr. Austin was here, I would tell y'all, she would be like, oh, that's not fair. The trait needs to be on there too. Because Dr. Austin, her whole campaign is sickle cell trait.
Yeah.
So y'all might hear that from her.
Yeah, I hear that. Yeah, but the law as it's written is just disease.
We got to start. We got to start somewhere.
Absolutely. That's what I feel like. Yeah.
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 Well, I want to thank you both. Well, it was three of you who joined us to talk about the Texas Sickle Cell Registry. Thank you for spending time with us this evening and your commitment to engaging directly with the sickle cell community. Again, thank you everyone else who joined and making your voice a part of this conversation. And again, please, for those who attended, don't forget to complete the virtual suggestion box. And I've already dropped the link in the chat. Your ideas help shape Escalate sessions, speakers, and topics. So if you joined tonight and you have something you would like to talk about, hear about, please complete that form. And again, thank you all for joining us tonight and sharing this very needed information.
And can I just add too, if anyone has a question they think about later, tomorrow, email us at any time.
Yes.
What's the email address? I can drop it in the chat for everyone.
Isn't it on the it's on the presentation, but I'll include my email too.
Okay.
I'll include mine as well.
Thank y'all very much for this. I'm from South Carolina, so I just wanted to kind of hear what y'all were doing in Texas. We have a registry here, but it's voluntary.
We talked to your South Carolina folks about the registry. Yeah.
And it is voluntary, and I try to get it out as much as I can. I do agree. I think ours includes the trait, which I think that is so critical also to have is to track the trait also. But it's voluntary here. We're pushing it as much as we can so we can get more awareness for all sickle cell. But I wanted to join just to see what you were doing. Join all networks just to see what's going on. And I hope one day we'll have a national registry where everybody can be accounted for. But I did enjoy your presentation. Thank y'all so much for the information tonight.
Yeah,
and thank you for joining.
Yeah, we reached out to South Carolina, and we were of particular interest to us because it is also an opt-in registry. So that's the only other one, as far as I know, across the country. Yeah.
Thank you so much.
Thank you.
Okay, well, we don't have any more questions. I'm going to go ahead and close us out. Thank you, Miss Etta, for joining. And thank you all again for joining and sharing this information with us.
All right. Thank you. Thank you, Shamonica.
Thank you.
Thank you so much. Bye.
Bye.
Thank you.
Hey, Shamonica.
Hey.
Yeah, I'm glad I got on. I know it's the last minute, but thanks.
Well, I'm glad you made it too. I appreciate it. It means a lot.
Oh, no problem. I will see you in LA, my sister.
Yes, you will. I'm bringing my daughter, so it'll be me and Rory there.
Oh, okay. Okay. When you leave?
I'll come Wednesday, leave Sunday.
Okay.
They didn't.
All right.
I wasn't asked to do anything extra to after I'd already booked my flight, and I was like, "Y'all I already booked my flights."
Right. Okay,
So I
then.
get there on noon Wednesday, so that's kind of early, and I leave like mid morning on Sunday.
Okay. All right.
Well, all right. I'll see you then.
I'll see you then. Bye.
All right. Bye bye.